In addition to being a member of this congregation, I wear other hats. Mom to Isabel, who is now a barista on Sunday mornings and who will be graduating from high school this spring, and to Hannah, who will be moving on to high school next fall. Wife to Andy, who was raised Jewish and agreed that our girls would also be raised UU. And daughter to John and Gwen Burens, whom many of you probably know. Dad was senior minister here recently, Mom is a retired Episcopal priest, and I quite literally grew up in several churches, including All Souls in New York, where Vanessa and I helped run the Sunday school together for a while. The professional hat I wear is as president and CEO of the California Association of Public Hospitals and Health Systems, or CAPH. You're probably familiar with San Francisco General Hospital. In fact, there are 16 similar hospital systems across California that are there for you if you are on Medi-Cal, or are undocumented, or are having a psychotic break, or get into a car accident, or need regular primary care, whatever is needed. These systems are the ultimate backstop of our healthcare delivery system, yet even in the best of times are often the most taken for granted and neglected, even in a state as progressive as ours. Needless to say, 2025 was the worst year in my 21 years at CAPH. Although we thought we were prepared for a difficult year ahead, none of us could have predicted the intensity, magnitude, or unprecedented nature of so many actions. DOGE, $1 billion worth of cuts from Medicaid, threats to gender-affirming care, ICE raids. It all took a brutal toll on the doctors, nurses, and other providers, but most importantly, on the patients that public hospitals are committed to serving. Every day, the leaders of public hospitals had to dig deep, demonstrate resilience, and find creative ways to assure patients that they were indeed safe. They had to pivot from initial plans to expand certain projects to shelving them, then contemplate how to scale back existing services. It was a disappointing, disorienting, and demoralizing year. My role was to advise, support, and console the leaders of these hospital systems and to fight in the trenches for these vital and powerful health institutions that were and remain under siege. Speaking to them last month, I offered 3 pieces of advice, which I will now offer to you as a community with shared values. First, I reminded them of the privilege of our mission. We are so lucky to do meaningful, purposeful work on behalf of those who need us. Challenging times for people working in social justice are clarifying and unifying. Second, the power of keeping a long-term perspective in this moment and remembering that progress is rarely linear. There's an old Jewish teaching that says, "It is not your duty to finish the work, but neither are you at liberty to neglect it." Even though we won't likely be around to witness true equity, access, and quality, we must continue to work towards it, doing the best we can with what we've got, and trust that the work will be taken up by other people after we're gone. Finally, I reminded them, and I remind you, of the power of joy. Some might think it's counterintuitive or maybe even selfish to be joyful when people's access to basic services or their fundamental safety is being threatened. But joy can actually be a healthy response to challenging times. As the poet Audre Lorde said, "The sharing of joy, whether physical, emotional, psychic, or intellectual, forms a bridge between the sharers. We will only get through this time by building bridges, and we must do so joyfully." That evening at the conference, we had dinner and then danced, laughing together the next morning as we gave out Golden Dance Shoe Awards for the most inspiring moves on the dance floor the night before. So here is to more joyful, purposeful, ongoing work out in the world and within this community. We will continue to get through it, make a difference, and spark joy.